yeah, but she's running.
She's running.
Yeah, yeah.
But we got a good guy.
Doctor,
Running.
how are you? Great to see you again.
Good to see you too.
Hello, hello,
Got the ladies
hello.
behind you.
Oh, wow, look at y'all.
Good to see you.
Micah, you look beautiful as well.
You're talking to Micah.
Good to see you guys.
We have to have a pretty boy, right?
You guys ready?
I guess that's the official start.
All right, ready? Good morning, everyone, and welcome back. I'm excited that we get to continue our conversation about improved health care here in Georgia.
Saying if there's no other questions.
Hello? Test. There we go. Good morning again to everybody, and thank you so much for being here. I'm excited to be talking about improved health care here in Georgia again today. Today, our state is taking another huge step towards delivering better and more affordable access to health care. Today's announcement by Governor Kemp of the Georgia Pathways program once again puts partisan politics on the back burner and embraces innovative, policy-driven initiatives. As I mentioned last week in the press conference, for over a decade, healthcare policy decisions have been unfortunately made in partisan corners. I can assure you that that will not be the case here in Georgia for the foreseeable future. Georgia Pathways, via the 1115 federal waiver that is being submitted, will allow Georgia to modernize our Medicaid system and literally uplift and empower thousands of hardworking Georgians. This program is going to connect those thousands of hardworking Georgians with career opportunities and community programs. These opportunities and programs have the ability to change the entire trajectory of these hardworking Georgians' lives and their families. This program also has the ability to accelerate the rate of prosperity into communities all over this state by improving the delivery of health care one family at a time. Georgia Pathways, in conjunction with Georgia Access, will serve as a transition point, not a permanent position, for those living on the fringes of poverty. I want to once again thank Governor Kemp for his leadership on this important issue.
Thank you. Well, thank you very much, Lieutenant Governor Duncan, for being with us again today, and I certainly want to thank all of the hard-working legislators that are standing by me today, as well as some of our executive staff for their leadership really over the last year in regards to health care. I want to thank you all for being with us this morning. And as you know, when I launched my campaign for governor, I promised to champion policies that grow jobs. I pledged to make Georgia the #1 state in the country for small business. I vowed to fundamentally reform the way government spends, taxes, and operates. I pledged to grow rural Georgia, support our farmers, and protect our Georgia values. And over the last 11 months, we worked every single day to turn those words into reality. We've chopped a lot of wood, as we say, and we've made a lot of progress. Since taking office, I've stood here in front of these steps many times. We've announced economic development projects with thousands of jobs and millions in investment. We've touted record employment numbers, rising wages, and unemployment numbers that are the lowest in 2 decades. And we've announced that Georgia's ranked the #1 state in the country for business again for the 6th year in a row. It is a great time to be a Georgian, and I really mean that. And I'm proud of our many accomplishments at the Capitol and throughout communities around our state. But too many of our friends and neighbors, family members, co-workers, and colleagues cannot afford health insurance. Too many are one moment away from disaster. It's time to put hard-working Georgians first, ahead of the special interest in the status quo. We must fundamentally reform health care in the Peach State. During the 2019 legislative session, I was proud to champion and then sign the Patients First Act. Since then, we have worked to craft a Georgia-centric reforms that will lower health care costs, improve access to affordable health insurance, and enhance health outcomes in all parts of our state. Recently, we announced Georgia Access, which will lower premiums through a state reinsurance program. We will make it easier for Georgians to purchase the right plan, right price. We will help employers who want to invest in the health and well-being of their employees. But today, too many hard-working Georgians struggle to afford any type of health insurance. These folks are working, they're trying, but they can't find a way to make ends meet. When sick or injured, they head to the emergency room, or they just stay at home and pray for the best. Today, I'm proud to announce Georgia Pathways, our innovation waiver that will help thousands finally afford health insurance. This plan reflects our priorities and values. This health care reform will put hard-working Georgians first. Right now, in Georgia, there are hundreds of thousands of Georgians who are working, training, or volunteering. They can't afford employer-sponsored health insurance. They can't afford a plan on the open market. They need coverage, but have run out of realistic options. Through the Georgia Pathways Innovation Waiver, we will shake up the status quo and give 408,000 Georgians the opportunity to purchase affordable health insurance. We will bring hope to what many feel like is a hopeless situation. Here are the basics. If you work 80 hours a month, train for 80 hours a month, or volunteer for 80 hours a month, and make less than 100% of the federal poverty line, you will be eligible for insurance in Georgia. The state will pay for your portion of the employer-sponsored insurance. Or, if that option is not available, you will be enrolled in Medicaid. This is not a free handout. Hard-working Georgians who qualify will have skin in the game, paying a monthly premium determined by a sliding fee scale. This, however, it is a path forward towards higher earnings, better opportunities, and a healthier future. Right now, state employees are encouraged to take the Real Age test and download the ShareCare app, which monitors and rewards healthy behaviors. The goal is to get as many green days as possible, but the real aim is to be healthier, which has numerous benefits for the state as well as the employees. Georgia Pathways embraces this same approach to help hard-working Georgians live better and provides rewards to encourage you along the way. The premiums paid by those who enroll in Georgia Pathways can be used later for prescription drugs, eyeglasses, or even a gym membership. You can enhance your spending power by completing healthy activities, earning points to spend at a later date. We will ensure a safer, healthier, and more prosperous future for our state, one hard-working Georgian at a time. In short, Georgia Pathways is an opportunity for those who are more than deserving. Through their employer-sponsored insurance plan, hard-working Georgians can establish a primary care physician, seek care when they need it, and finally have peace of mind. This approach will dramatically reduce the cost of indigent care for our local hospitals. This proposal will make a positive impact for generations to come. While thousands of hard-working Georgians have reason to celebrate, this proposal will draw many tweets and statements from the opposition. They have no real solution to the complex challenges we have in Georgia, but they do have a well-scripted, politically filled rhetoric slogan that sounds good on television, but doesn't live up to the hype. Unlike Medicaid expansion, which will literally cost billions of dollars, Georgia Pathways will not bankrupt our state or raise taxes on our families or our businesses. Unlike Medicaid expansion, which will worsen the doctor shortage and compromise access, Georgia Pathways will help put more Georgians on private insurance, giving more Georgians more choices when picking a provider. Unlike Medicaid expansion, which undermines our core values as a state, Georgia Pathways provides a hand up and a way for our citizens to thrive. Medicaid expansion is a risky, one-size-fits-all approach that costs too much and fails to deliver. Georgia Pathways is innovative, it's affordable, and tailored to meet the health care needs of Georgians in every part of the Peach State. In year one of the Kemp administration, we have empowered job creators, invested in our teachers, prioritized school security, and protected the most vulnerable among us. Together, we have taken on gangs, cartels, and sex trafficking. We've worked to make our neighborhoods and our communities safe. Now more than ever, we must recommit to doing what's best for the people that we are honored to serve. We're talking about real families with real struggles and a real opportunity to do something that makes a real impact. So join us as we submit these well-crafted plans that will enhance access to affordable care, lower health care costs, and improve outcomes. Proposals tailor-made for our state, our people, our friends, our neighbors, and our constituents. Reforms that shake up the status quo, rise above politics, and meet the challenges and opportunities that exist in the Peach State. Let's move forward together and champion Georgia Pathways and Georgia Access, two Georgia-centric plans that address the challenges ahead, showcase our priorities, reflect our values, and most importantly, put patients first. Thank you for your time today, and we will continue to keep you updated as we move along with the waiver process. Thank you very much.